This is the Physical Activity Researcher Podcast, a podcast for researchers of sedentary behavior, physical activity, and sports. Join for a relaxed dialogue about research design, practicalities, and, well, anything related to research. Learn from your fellow researchers useful and relevant information that does not fit into formal content and limited space of scientific publications. And here is your host, researcher and entrepreneur, Olli Tikkanen.
Welcome everyone. I'm thrilled about today's guest and our forthcoming discussions about human-computer interaction and interaction design for digital health and physical activity. Our guest is working as a lecturer in digital health at Open Lab and at the School of Computing at Newcastle University, UK. He describes himself as a digital media generalist focusing on human-computer interaction research. Ladies and gentlemen, please welcome Dr. Jan Smeddinck. Welcome, Jan.
Thank you, Olli, for that kind introduction, and thanks for having me. I'm glad to be your guest.
Yeah, really nice to have you. So, I don't know too much about science of human-computer interaction and interaction design. So, could you tell me the basics of these themes?
Yes. So for human-computer interaction, it basically is a discipline that brings a little bit of psychological, sometimes sociological elements into computer science. Actually, is more or less rooted in psychology, in a subdiscipline called human factors. And the basic thing that we address in this discipline again and again in all sorts of different contexts is really how can we make systems work well or better for people? And then also at the same time, what does it do to people or groups of people to be working with digital systems and using them?
All right, sounds very useful field. And you are working in physical activity. So how does this works in digital health and physical activity?
So, of course, there are a lot of applications being developed nowadays, and there are a couple of things that the angle that we bring, I think, can be quite helpful. For example, in making sure that the applications that we develop are not only useful from a medical point of view, or that they produce interesting data, but also that the way we interact with these technologies is actually beneficial and leads to patterns of positive use, and avoids, for example, addictive patterns or patterns where simply data is extracted from people by making them, use certain devices more or less like tracking devices. And the communication about all of this is quite key, and it's not easy to make things really work for people.
So could you tell some examples how you have used this in digital health?
Yes, there are, of course, various different studies. So you asked before, and I didn't finish to explain, I think, about interaction design, which is, of course, a related subdiscipline in design, mostly, that has a close relationship to human-computer interaction, which is sort of like the more researchy way of looking at this. And the interaction design part is more how do we actually make that real? So engage in close work with actual participants and users of the technology to figure out, what do they really need? What are their abilities? What are the limitations that a certain group may have, or that a certain setting of use brings in, to really closely consider this. And then in the process of creating solutions in such a design process, for example, to work highly iteratively, but then also to employ scientifically minded tools where necessary to make more deeply informed comparisons. All these bits are kind of important elements of our work when we try to come up with solutions that really work well and that avoid misunderstandings in the communication between digital technologies and the users.
And how much do you see this these fields of research, that how much is it, how is the balance between theoretical research and actually kind of hands-on creating solutions?
It's a very interesting and exciting field, I think, for many, in that there is quite a range of different interpretations of how people find their places and their role within HCI as the more researchy approach, or interaction design as the more hands-on design oriented, solution oriented, practical side of things. So it really depends on the role that one takes, and also the goals of a project. We often engage in projects that have very clear research goals. So then, of course, we use research methodologies, even though human-computer interaction often draws on qualitative methods as well as quantitative methods. So it can be that more classic research work, but it can also be very design oriented, and we have modern approaches within human computer interaction that very clearly reflect this. So not only do we normally do iterative development where we come up with, as soon as we have first suggested solutions or prototypes, we try to test them as soon as we can in the real world to make sure that there is good alignment between what we're building and, the situation, how it will be used and by whom it will be used. So not only do we do this sort of iterative development and testing, but oftentimes there's a notion of participatory design, which, of course, as somebody from Scandinavia, it's kind of a Scandinavian tradition that has been brought into the field. So you'll be well aware that it's this notion of having target users or end users or stakeholders of your technologies kind of engage in the different steps of how a technology is created. And then in even more modern approaches, we move into co-design, where it's even the goals of what is supposed to be built are built together with the future stakeholders, or the equivalent to co-design, sort of. This is very roughly speaking, but there's a related concept in research that goes down the line of action research, where the stakeholders take an active role in figuring out what the research should be about and how it should be approached.
So when you have this kind of co-design, how does the process go? And have you been actually doing this kind of co-design projects?
Yes, so this is again the exact nature of the approach depends on the specific project, but it really means to engage closely with stakeholders from the start. Often this is so in classic settings, in a little bit more participatory settings, one would often do, for example, interviews in the beginning about specific topic that you already have in mind, where you then go and try to build a little bit of a better picture about the requirements and abilities of your stakeholders. And with a more co-design approach, often this swaps to be a little bit more engaging, even in the original question finding. And so this can use workshop techniques, where there's a bit more freestyle discussion and open thinking in the beginning to even figure out what would be interesting to pursue. Sometimes this makes use of ethnographically inspired methods. Full-blown ethnographies are rare because they're very time intensive, but kind of the idea of embedding yourself in an actual use context, at least for a brief period, to build a better understanding as a designer, so that when you then, for example, engage in co-design workshops, it is less likely that you superimpose your own ideas and approaches to solutions on the actual stakeholders.
Yeah, sounds like a very useful method for product development also. So how do you see, I'm working a lot with the activity trackers and wearables. How do you see this one? What kind of aspects you would think to find from human computer interaction that hasn't been done now with many of the activity trackers, and what do you think would come up when approaching more from this direction?
Yeah, there are a lot of interesting points. Of course, a lot of elements of what I just described have made their way into hands-on real-world development practices, right? So this is not like a holy grail solution, and it's not that I'm thinking that nobody out there is doing this, but from a research point of view, there are some very interesting topics that appear that could do with more attention and that can contribute. To the whole area, I think. So we see a lot of very interesting developments that are very much inspired and driven by the developments in sensor technology, right? The ongoing kind of shrinking of the footprint of sensing technologies and the increasing throughput and accuracy. They offer very exciting technological kind of capabilities. And then there is a certain tendency to use that and say, okay, what is the most exciting technological thing that we can make happen with this? And that is great because it leads to new devices and approaches that do truly offer very interesting doors, new insights into, daily behavior, physical activity, and so on. So it is really exciting, but it is also kind of easy once you go down that road to kind of lose track of what people actually need and how they might truly benefit from this. So not only is it important, of course, to keep an eye on what I think most modern companies have caught up with pretty well, which is user experience. You need to make sure that devices not only function well, but so the classic usability element, but they also engaging and enjoyable to use. So that user experience element that has originally been highlighted in these disciplines a little bit more in the 90s, early 2000s, this has really made it into broad use. So what we are focusing on more and more nowadays is to make sure, for example, that societal impacts are considered, that we work with groups in public groups that represent interesting elements of the public that might otherwise be overlooked or that aren't the primary candidates for consideration in such project development, for example, and to then ask questions: what does it do to these groups that these technologies are developed, and how can they be considered? And how can we make sure that we, kind of develop a good angle of societal impact? And a lot of this is really important. So we see that with the tracking technologies that are part of this, that offer very interesting insights. Like if you think about like the whole trends of quantified self, and also the medical side of things that is closely linked to that, offers very interesting and exciting potential insights. But at the same time, they are also potential downsides of such intimate data collections, and these need to be considered as well. So this brings basically a lot of overarching angles that you can only really study and start to understand when you don't have the perspective of one individual product developer, but when you can take a little bit more of an overarching perspective of what these technologies do.
Yeah, that makes all the sense. So about societal impacts and downsides, what else do you see than the intimate data collection? What other downsides you have found?
So we see a certain pattern that has been described using different terms, but where one term that a student, Kieran Cutting, that I'm working with, has built stemming from a different background, but that also applies here, is justification practices. And that is that there is a certain tendency to see digital systems that produce data as an easy kind of source of information that one can rely on to kind of externalize behaviors and make it so that it's not your own responsibility necessarily. So you can say, well, the tracker said I moved enough, so I clearly have done enough. Or the tracker said I should be doing this, so I now need to go out and do my sports, and that in a social situation may keep you from engaging in meaningful ways with the people around you. So we see that sometimes these technology-based solutions generate patterns that interfere in not ideal ways with social life, for example, and that is something that can easily kind of creep up into behavior, and it's not always easy to spot and understand. So we see that, for example, as one thing. Or when we're looking into recent trends into using these sorts of data that are generated to then form spontaneous, individualized cohorts in medical sciences. This is a very interesting capability that you gain to now say, look, I have somebody who displays this and that, I don't know, development in their heart rate variability, and it's potentially something to consider. So then you can build a cohort of people who are similar and kind of look at their trajectories, or you can even look at treatment pathways, and then you can produce sort of an output which is the most promising approach going forward. And then there's a certain danger that this gets misused and interpreted as a black box sort of, this is the only right response, and we can take individual responsibility out of the equation. And that is something we clearly think is one of the problematic patterns. Yeah.
No, very, very interesting point. I think this justification practices, it's really interesting. I'm always surprised how much even people who know that it's quite simple sensors that are measuring something which is not really accurate, and they kind of believe, like you said, all right, I slept really badly, it seems, even though I felt that I slept better than ever. And they still kind of tell this story even when they know that the trackers are usually not very accurate in most of the variables they provide.
Yeah, they certainly invite over interpretation, and that certain confidence in and people are surprisingly willing to trust these systems and recommendations they put out. And I think if as you personally, I think, are very well informed how these devices really work, and let's say how narrow the bandwidth is of what these sensor devices actually capture about the full spectrum of meaningful human behavior, then it's very clear that the breadth of these recommendations that are often made based on these narrow sensing and processing capabilities can only be very rough kind of recommendations, and that these are exactly the type of questions where, as a human computer interaction researcher, you then start wondering, okay, so how do we then, when we present outputs, when we present recommendations, make clear that this is understood without completely overcomplicating everything and making the output unusable, right? So I'm not saying that these recommendations shouldn't happen or anything. It's just really important how you frame it and how you convey it and how you scaffold the interaction with the system, because we understand these systems more or less as communication partners, and the more interactive they are, the more of a kind of subconscious anthropomorphization happens in the background. So this is a really tricky area, and it's becoming more and more relevant as the systems become more conversational, and we see a lot of the interaction with the systems start to kind of make use of sort of digital agents that imply that these systems are really, really smart. So we need to be aware of the things we imply and what sort of an impact that has on the users and stakeholders.
Yeah, I think it gets really tricky because, especially for consumer trackers and devices, you want to market as many features as you can, even though many of them are not accurate.
This podcast is sponsored by Fibion, a research device that has been shown to be valid in tracking sitting, standing, physical activity and energy expenditure. Furthermore, Fibion has been shown to be valid categorizing physical activity into light, moderate and vigorous intensity. In addition to scientific accuracy, Fibion provides automatically produced and easy-to-understand reports for research participants. Get scientific validation and learn more about Fibion at fibion.com/research.
So how do you see what should be the solutions? That should you communicate differently that this is not maybe really accurate, trust yourself also? Or do you think some of the features should be left out which are not accurate?
Yeah, I mean, there are these different layers of how we approach this. I mean, in a specific product development, you want to probably make sure that you do good iterative development and testing, and that you also keep an eye on this after product release, right? That you make sure that you have some sort of feedback channels that give you an honest picture of what's going on. And oftentimes, for example, having a simple questionnaire with predefined answers, people will respond to that, and you will get some clear picture on the things you asked, but you never know what you overlooked to ask. So to use modern methods there on that side is very informing. And then at the same time, as a research discipline, we try to really do research projects where we take multiple of these different approaches and we start comparing them and see what works well, what doesn't work so well. So we know that there's this complex relationship between how smart a system appears to be and the sort of messages it then conveys. And that's really something where the discipline of human-computer interaction then oftentimes comes up with design recommendations, and that is something maybe that, from a practical point of view, that can actually be a helpful way to make some use of what this discipline is outputting, because we find that oftentimes there isn't quite as much close exchange between human-computer interaction, the research discipline, and then interaction design and user experience as it's practiced in the real world out there. There isn't quite as much exchange as there could be. And one easy way, really, if you want to kind of get the actionable outputs from the discipline, is if you look into kind of the research publications and then simply add as a search term design recommendations, because a lot of the research work that is produced will try to close with these sort of actionable outcomes of the research. And these might then tell you, for example, with a specific sort of, I don't know, chat-based communication system about your training goal achievements, how can you make sure that there's a positive interaction that does not mislead the user and is actually a positive experience.
So you are probably quite familiar with the main design recommendations. Could you tell us some examples that have been laid out from the research findings?
Well, there's very basic things to treat an interaction like a conversation that you want to keep friendly, right? And then beyond kind of general things that have so far been very well encapsulated in terms of usability and user experience guidelines, it really depends on the use context and the type of technology you're building. But I think a lot of this, at the end of the day, comes across as quite a bit of common sense, but it's really helpful to sort of look at these summaries. And there are really good resources that get compiled out of this. So I think you will find very good summaries of the actionable elements of all of this, for example, on interactiondesign.org as a free sort of resource collection. Beyond this, it depends. Are we talking about a wearable? Are we talking about interacting with virtual reality? Are we talking about playful interaction? Are we talking about applications and technologies developed for, I don't know, use in businesses? It really depends. So it's hard to say to boil this down to simple generalizable rules.
Yeah, maybe one, if we take one example that we have had for quite a long time, we have had consumer activity trackers and other kind of trackers also, and And now there's this discussion of digital health, and that you could go for the general practitioner, your medical doctor, that with your data, but it should be accurate data. And how do you see the step, like Apple Watch starts to have some kind of arrhythmias detection? What are the important points when we move from consumer activity trackers to more medical activity tracking? That what should we consider making this quite a big step?
Yeah, I mean, there are many elements to this that have to work out in order to eventually reap the benefits that I think are really potentially there, even if the employed sensors aren't the most accurate, and there may be kind of strictly medically oriented devices out there that are, a bit more spot on. I think there's still incredible value in these sorts of activities. It's just difficult to make real and to make come together. So from a human computer interaction point of view, again, I would emphasize that it's very important to communicate clearly, not only with the immediate users of the technology, so those people who would wear the activity tracker, but also with the other involved stakeholders, so medical professionals, any intermediaries, to really communicate clearly what it is that is captured and what is not captured. So how far can I interpret this? Yes or no? So there's this whole side of interacting with it. There's a very, very interesting element also closely linked to sort of data ownership and analytics, because I think that is what we need to sort. And my thinking on this, and not only mine, but a lot of researchers are now starting very interesting projects down the line of like, where is data ownership, and also what are the protocols and procedures that we can apply to this data, so that becomes a little bit more transparent. So I really think that we need to do, even though it may not sound super exciting, but there needs to be a good consolidation work on sort of inter-exchange formats and open protocols that allow like a liberalized exchange there. And we really need to think about data ownership as well. There's a certain pattern where with a lot of modern devices, the data basically gets collected by a company behind them, and there are good reasons for that to happen. But basically, the data gets sent away, and then the people who wore the data then become customers in buying information back, and they may do that through paying more for the device upfront, or it may be some sort of service subscription model to then get insights back. But there's a side effect of this, that the data is locked away, so it can't easily be repurposed on behalf of the user for such sort of kind of diagnostics and deeper insights, linking it with other data. So in order for this to happen, I think industry needs to get together, and we need to develop models where, business can still function. So profits need to work out somehow. But at the same time, we work towards open ecosystems where all this becomes more interchangeable and linkable. I think that is a very important kind of underlying development that we need to foster if we want really on a societal level to be able to reap the benefits that this holds. And I mean, it's in this current crisis, that's a very clear point where you could easily anchor a discussion around potential benefits that you could see if you had, for example, somewhat persistent body temperature assessment throughout the population.
Yeah, that's a very interesting point, the body temperature measurement. Do you know if there's anyone working on that at the moment? It's quite an interesting possibility.
Yes, I mean, there are these kind of networked internet IoT enabled body temperature thermometers. At least I think in the US there has been some very interesting data facilitating basically foreshadowing of sort of feverish conditions, developments in certain areas. So this is certainly happening. But even there, this is a company saying, look, we are collecting this data and we can contribute to these interesting patterns. And then on a kind of very high level, a government agency may approach them and they may get certain like derived data access to this. But I think in order to really make this function, we need more like a marketplace thing that is also bottom up enabled. So users of the technology need to be empowered to go and say, I want to make it possible so that my data is used for these and these purposes. And then again, it becomes a very interesting human-computer interaction question to work on making sure that users understand what that means, what they're agreeing to, what the limits of such use are, to be able to review it, what happens to a digital legacy, eventually with all this data footprint that is built up. That these are kind of very current issues that the discipline is working on. Yeah.
And how do you see now in the current situation that Apple and Google have started working together with some kind of tracking application that we could trace the disease better? And then there's also some COVID-19 trackers which work with the Bluetooth. I saw that there was already some device published that a workplace can buy it, and then it will track that who were close to each other. It works with the Bluetooth. How do you see these technologies, and what problems and pitfalls you see in this situation?
This is such a complicated area overall. So I think, yes, they can clearly deliver very potentially valuable insights. And I think it's right that these get explored. On the other hand, we need to make sure that we prevent misuse, that we prevent, as we said earlier, over-interpretation that banks on the wrong side of the reliability of that data and insights that are actually enabled. Now, as far as Google and Apple are concerned, they are actually at a size, they engage closely with the research communities. And I think that at least the portions of these protocols that I've briefly looked at, I have to say very briefly only, they seem to be open protocols. And as if that is the case, then I'm all for it, because that's exactly the thing, as a research field. There are a lot of people working on this, and it's possible to propose all sorts of things. But at the end of the day, there needs to be sort of work in the practical side of things that is hand in hand with the involved businesses, and oftentimes the giant ones do take a leading role there in establishing what then becomes a standard for exchange. So yes, keep a close eye on that being as open as possible, but I think it's a valuable development that we're now seeing, and it's one of the ways that such a crisis can also be an opportunity. But again, we need to take a close look at what is collected, and I'm always very interested in making sure that we can keep users empowered in this scenario. That it's your right to say that my data is used for this and that, and to rethink data ownership, because in a simple way, this is a drastic oversimplification, but if you give your assets away, and if data can be seen as a valuable kind of 21st century asset, if you as a user keep on freely giving your assets away, then you can't expect to really have a voice in how these services are shaped. So I think that's a very interesting field to be working on. And there's a lot of organizations that are doing that, not only working on positive use patterns and engagement patterns with technology that don't impede like our life as healthy social human beings, but also that side of like kind of keeping control over your data and being well informed of what's happening with this. So I don't know, for example, mydata.org is a very interesting organization in this regard.
This podcast is sponsored by Fibion. Fibion is an accurate sitting and physical activity tracking device and analysis platform. It is a great tool for projects that aim for behavior change in sedentary behavior and incidental physical activity. Fibion provides easy-to-understand PDF and web browser reports for participants. Other features include comparisons to recommendations, linking results to health risks, achievement cards, and interactive goal-setting tool. In addition, Fibion provides an API that allows for easy integration to other systems and applications. Learn more about Fibion at fibion.com/research. Fibion, from researchers to researchers.
How do you see now? It's a special situation in the world that even our right of movement is limited, whether it's within your country, a lockdown, or so on. So it's kind of against some of the basic human rights that there is a way to limit now, and it's needed. Do you see that there might be some problems to the rights, or we take away some rights, for example, that people can be tracked more closely in this situation? Or how do you see this from the digital point of view?
Yeah, it's an interesting and tricky question, and of course, human-computer interaction is a very interdisciplinary field. So we tend to kind of willingly give answers to very broad questions. But I have to point out that I'm not a public rights expert, not a policy expert. So I think this needs to be discussed, and it is discussed on a societal level. Of course, there's this certain danger, as people in other areas have rightly pointed out, that if we rush to install detailed tracking and contact tracing now on a population level, then it's very important to consider ways that whether we want to dial this back or how it can be regulated moving forward. I like the approach that for example, in Germany, that they are developing sort of like data tracking and contact tracing applications, but they frame that more like a sort of willfully giving your data for a cause. And I think such a framing can be very helpful. So there's a really big difference between making something available and even encouraging people to use it to contribute to a common cause for a certain period of time, and then to be able to say, okay, this is it now. 3 months later, I stop feeding my data. There's a big difference between such approaches and say for example, a mandatory, obligatory installation of a tracking app that integrates deeply with, say, your mobile phone and stays there, and you have no clear say and no clear communication about what is sent away and what somebody else can derive from this data.
And if I go a little bit backwards, you said about open data systems, that the data would not be owned by a corporation. Who do you think could be the stakeholder to be able to do kind of global data bank that is not a corporation? Who do you think could be a potential institute to do this?
Well, we see a lot of very interesting kind of protocol-based work that works with establishing more free nodes where potentially users can remain owners of their data. But of course, this can also be through a little bit more publicly oriented organizations. We can think about the not-for-profit space where the data can be held in the name of users, but is not necessarily exploited for profit, right? And there, of course, one might say, okay, it should be I don't know, potentially even a government supplying something like that as an infrastructure, but there are complications with that as well. So my intuition would be to consider a sort of multi-actor landscape there. And, if there is an organization that does some for-profit processing of your data for its own purposes, and you trust it, and it's clearly communicated what is happening, then that doesn't have to be a bad thing. It's just a space that is growing ever more important, and I think it requires good and well considered regulation in the long term, and also much deeper study to really better understand the issues as they develop, and kind of play a more and more relevant role in everybody's lives. Yeah.
Hmm. And we have had very interesting kind of general discussions about this field. So could you tell more about some of your projects that you have done? What were the main findings, and what have you done with human interaction design?
That's really a broad area of things we engaged with. I mean, my current role is in focusing on digital health, and there's a lot of interesting things really that kind of come across there. I can pick out a couple of very interesting things. So for a while we were working in a range of projects on making all sorts of support programs, be they more playful or more of a serious notion for physiotherapy, customizable to individual users, because that's one of the potential strong points of digital technologies in this space. Not only can they facilitate remote, for example, exercising, and provide good objective overview of the development, but they can be highly customizable, and they can sort of like this sort of adaptivity or customized patterns for development can happen. And one of the early things we noticed there is just how much it can be noted by users if you make such customization happen. For example, we had a project focusing on Parkinson's disease patients, and there was a game where you would collect certain streaks of stars that were spread across the screen. And the pattern, the scale of the patterns would change depending on your individual development, and basically move further away in order to make it a little bit more difficult, or closer to you in order to make it a little bit more easy. And users quickly notice these patterns. So and we noticed that is a human-computer interaction problem, because they were complaining, like, am I not good enough? So the game seems to make it easier for me. I don't like this. So and then we identify these problems and we find a practical solution. So in this case, it was that we then internally rescaled the representation of the player and the player's reach, but we left the visual appearance of the star streaks identical on the screen, if that makes sense. And that wasn't noticed anymore. And in this situation, it fixed the problem. But it is really context dependent. In some other situations, you may want to display such a development. You may want to make it visual and clear to the users. And that is why this discipline is coming up more and more with processes about how to make sure most efficiently that we get these things somewhat right. There are many other examples of interesting findings that come out of very practical concerns like that. Yeah.
And I think this kind of support programs for physio, and they are very relevant now as many people, especially the risk group people, are in self-isolation. Could you tell more about what did you learn from this kind of programs for physiotherapy?
Yeah, one very interesting one is that you can make it work, very nicely with patients. And they, to a point where you can show that this works comparatively well, depending on the measures, but comparatively well in terms of development, for example, in functional reach to traditional therapy. But it is super important that the other stakeholders are not overlooked. So this means, for example, friends and family members who become bystanders and then completely change the context in how such a technology is used. And that also changes how the actual patients or primary users interact with it. Another one is the role of the professionals, in this case, physiotherapists. If they don't like it, this will never take hold. If the configuration that they need for an individual patient to be using this technology exceeds, I don't know, 90 seconds to 120 seconds, there's simply no way that they can make it work in their daily lives. So the technology, no matter how good for the patients, will see no adoption. All these things come from that kind of close consideration in context, which is easy to overlook in product development, but it's just incredibly important if you want to make things right and work for people. That's what I said in the very beginning. And there are other things with therapists. We had oftentimes they do their own sort of ad hoc interpreted use of technologies, and this happens with wearables as well. So to stick with the example that I said earlier, just a minute ago, with the kind of movement-based rehabilitation support programs, we see ad hoc recontextualization where they say, "Oh yeah, I might use your software to make adjustments for the user, or to tell it how to adjust automatically within which safe kind of limits. But I could also just put this balance board in front of it and have my patients use it with that." So these sorts of recontextualizations are very interesting to observe and hard to predict. And we see that with support technologies. We built a very fancy customization tool for therapists once, where they could use a 3D figurine on a tablet and then basically manipulate it into certain extreme poses, or kind of enact with the thumb by grabbing like the little arm of a 3D figurine and moving it around to basically tell our software what is the movement range that a certain patient can safely do, right? So that we can then have automatic adjustments within these boundaries. Now, they found that very interesting and better than the kind of parameter-based, how many degrees sort of interface we had before. But the most use that they said they wanted to take out of this tool was actually to use it as a foundation for communication, both with their patients and with colleagues, about what patients can do, or when they hand a patient over from one colleague to the other, to then be able to clearly communicate what the development has been and what they consider good limits or working goals to be. So these sorts of things require this sort of close work with the participants, right? And this is why I said earlier, we have this development not only checking iteratively and in a regular sense whether technologies work within a predefined setting that we as researchers or practitioners come up with, but to really work actively with the stakeholders, taking quite a role either through participatory work or even like proper co-design. And then these sort of patterns can come up and emerge, and we can make good use of them.
Mm. And with this support programs for physios, did you have other technological features than a video call and then this kind of 3D figurine?
There was. This is a multiple research projects spanning sort of effort. So yes, one thing I was thinking about again the other day. There's a really interesting feature when you want to think about things taking hold in the real world right now. For example, is really the questions: how can the individual practitioners still stay in contact with their patients, right? And in the remote situation that we're facing now. So the interesting questions aren't necessarily about how can we replace in-place technologies with sort of things that people can use at home, but also how can we keep that communication and engagement that comes from it up between practitioners and professionals and patients, and how can we really kind of make sure that communication and guided treatment can still happen. And there's a lot of interesting developments there, of course, moving now more and more from, of course, the kind of common sense integrations with video-based work that you can do here, and then, of course, more recent developments into the kind of virtual reality, augmented reality spaces. Yeah.
Mm.
This podcast is sponsored by Fibion.
My name is Dr. Paul Batman, and I'd like to just say a few words about Fibion. I've used it a number of times on different projects that I've been involved in and find that it's incredibly reliable, very valid, and incredibly sturdy. I love the graphics that come with it. It really is very clear and can easily see the active and inactive periods as well. So I'd certainly recommend Fibion to anyone that's interested in finding out more about sedentary behaviour, particularly the concept of sitting and how we can possibly break it up with some really good, valid information.
And how do you see at the moment there's the risk groups are self-isolating, and for them physical activity, maybe some kind of rehabilitation movements if they are in rehab, it's very important, but now they are in isolation. How do you see the distance coaching? How could it work in this situation?
Yeah, I mean, this is a very exciting time in that regard, because it's now like, well, these sorts of deployments of new ideas and explorations of new concepts now happen at breakneck speed and at a much larger kind of saturation than what we had before. I mean, of course, people have been working on this for many years now, but we now see a wide scale sort of deployment that is just very interesting. And it's also interesting to note that the most stable foundations seem to enable really quite a bit already. So video-based work, simply a reliable back and forth communication channel, can already do a lot. And making sure that happens in a kind of uninterrupted and fluid manner is very important. But then at the same time, there are really good tools that have been developed and purpose-built really for enabling sort of remote instruction, and also remotely checking whether exercises are executed correctly, that are proving immensely valuable, I think, now. So one of the main things in a very crude way, you can compare these technologies in this specific space of physiotherapy exercise kind of execution and tracking. The baseline for that is a piece of paper, right? Is a piece of paper with a couple of scribbles of or pictures, photos of how to execute the exercises, and that can be very helpful. But then you have no way of seeing whether somebody is actually executing the movements correctly, and that actually, even before this situation, is not really ideal, because then people come into the practice every few weeks, and there's a brief opportunity to check whether execution is done correctly. But then people go off and do it on their own for 2 weeks, and oftentimes it's not executed in the right ways, or repetition sets get forgotten and misinterpreted or misreported. Not always, in bad faith. It just happens. So there's an immense value that digital technologies, be it camera-based tracking or body-worn sensors, can bring in this space and are already delivering on.
Yeah. So do you think in the future we will be, when we're building houses, that we will build a separate room for camera-based tracking or some kind of thing where we can actually use all the new technology effectively?
Yeah, that's a good question. How far in the future are we talking? So I think really that there's quite a good chance that camera-based recognition will improve to such a degree that, basically putting one or two cameras anywhere, even in an ad hoc manner, would enable you to interpret body movements even of multiple people in a scene in a rich enough way to facilitate this. So I don't know whether the houses will necessarily be built pre-equipped, but it will certainly be very common that tracking equipment is in an individual's exercise room in a house, I think. Yeah, absolutely.
So it has been very, very interesting points. I think we are running out of time soon. So few questions. Where do you see the scientific field of human-computer interaction going in the future?
Well, very interestingly, so basically, there's much more work to be done, even on really understanding what it means for society to be interacting with digital systems we already have, with the more and more important role that smartphones and computers play in our lives. The embedded systems field is very interesting. And then we have two, I think, major developments that are up and coming. One is alternate and mixed realities, virtual reality, augmented reality, and our interaction in these spaces, both with digital systems and with each other, as it's mediated through this entirely new sort of channel. That is one big thing. The other big thing is interaction with AI and its physical manifestation through robotics. And these already exist as subfields in the area, and that will be very, very interesting to see how it develops. Closely related to that, as we start augmenting ourselves more and more with wearables and sensing that gives us really access to perceptions that we did never have before as humans, we are in a way becoming, for lack of a better term, cyborgs. And that will become more and more extreme, up to a point where I think we will need something like I don't know, a center for superhuman and cyborg computer interaction, or something like that. And these are really interesting fusion disciplines that are just coming to arise in the field.
Yeah, very, very interesting future direction. So, in the end, could you tell what kind of projects you are interested in, and if you're looking for some kind of collaboration, what could that be?
Well, thanks for asking that. Of course, the main future reaching directions are really interesting for like long-term considerations. And in the meanwhile, I think these topics we had earlier, we have some larger scale projects ongoing about sensor devices and combining multiple sensing devices with the same person to understand certain important concepts of daily living, like physical activity or fatigue, from this multi-sensor angle. So there's much more work that remains to be done there. And then also more close kind of near-term developments, I think, that are really interesting are around these kind of patterns of data recording and data use, and how we can enable good communication about what is sent and stored where, that gives a fair view to the users. We have this trend with open data, for example, nowadays, that a lot of governments and also private institutions are encouraged to open up a lot of data. And we see that happening more and more. Sometimes this is pushed for by policy. Sometimes this is done on free terms. But oftentimes this is put out in formats that aren't very easy to understand or to link up at all. So I think there's a lot of interesting work that remains to be done there, both in terms of user control and understanding, and then also allowing interactions, allowing kind of community-based analytics to arise, that are very interesting areas for more immediate work. Yeah.
So if any of the listeners are interested in collaboration in multi-sensor systems or open data protocols, please be in contact with Jan. Thank you for the discussions. I think there was really a lot of things I learned, and it really made sense. You made it really easy to understand, and I think it's really important work you are doing. So thank you for sharing your knowledge.
Yeah, thanks again for bringing me into the podcast, Ollie. And it was really, I think, an enjoyable discussion. And thanks for asking so many interesting questions today.
This podcast is sponsored by Fibion. Get scientific validation and learn more about Fibion at fibion.com/research. The Physical Activity Researcher podcast has created an activity tracker purchase guide for researchers. Get your free copy from the link in the podcast description.
Thank you for listening to the Physical Activity Researcher podcast.